Good afternoon, Kevin Hansen. I am Mihiraa. Let's begin the warm-up session. Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
Describe your typical working day.
My day starts with a prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after giving a handover to the next scheduled staff members.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
What are the current trends in nursing?
Some of the current trends in nursing include telehealth and technology in healthcare, the use of telecommunication and information technology to provide healthcare services. In the field of education, graduate education and advanced practice is on the rise. There is a push toward encouraging nurses to pursue higher education and advanced credentials, such as master's degrees and advanced practice registered nurse roles. There's also a shift from hospital-based care to community-based care, as more patients prefer to receive care at home or in outpatient settings. Alongside, nurses are coming up with innovation and entrepreneurship. That is, nurses are opening their own healthcare businesses, developing new products or services, or working for non-traditional employers.
Your preparation time is over. You can now start your OET speaking roleplay.
Hello, Mihiraa. I couldn't help but hear that cough from the corridor. It sounds really quite troublesome. I understand you've come in today feeling unwell. To start with, could you please tell me in your own words what's been happening and what's brought you in to see us today?
Thank you, Kevin. Yes, it's this cough. It just won't go away. It's been over a week now, and it's really starting to wear me down. I'm struggling to sleep, and I'm worried it's getting worse.
I can certainly understand how a persistent cough like that will be exhausting and concerning. To help me get a clearer picture, I'd like to ask you some more specific questions about the cough itself. Can you describe what it feels like for me? For instance, is it a dry, tickly cough, or are you bringing up any phlegm?
It's definitely a phlegmy cough. It feels really stuck in my chest, and it's a real effort to cough it up sometimes. It's worst at night. I just can't seem to stop coughing once I lie down.
Thank you, Mihiraa. That's very helpful to know. Now, given your history of asthma, I need to ask how your breathing has been alongside this cough. Have you noticed any other asthma symptoms flaring up recently? For example, any wheezing, that whistling sound in your chest, or any shortness of breath?
Now that you mention it, yes. My chest has felt really tight, especially in the mornings. I've been using my blue reliever inhaler much more than usual, probably 3 or 4 times a day just to feel like I can take a proper breath. I think it's whooping cough, and I need antibiotic treatment to get rid of this.
Thank you for telling me that, Mihiraa. It's really crucial information. I can hear how distressing this must be for you, and it's completely understandable that you're looking for something strong like antibiotics to help you feel better. I want to take a moment to explain why that might not be the most effective treatment for what you're experiencing. While I understand your concern about whooping cough, which is a bacterial infection, it is actually quite rare. The vast majority of the time, cough like yours is caused by a common viral infection. Antibiotics are designed to treat bacterial infections, so they are completely ineffective against viruses. Taking them for a viral illness won't help you feel better and can contribute to a serious problem called antibiotic resistance, where bacteria evolve and these important medications stop working for us when we truly need them in the future. What you're describing, the chest tightness and needing your reliever inhaler more often, points very strongly to what we call an asthma exacerbation. It seems the recent respiratory infection you've had has caused a significant flare-up. The virus has irritated your airways, making them become inflamed and swollen, and it's also triggered them to produce a lot of extra mucus. This combination is directly causing your persistent cough, the tightness in your chest, and the difficulty breathing, as your airways are much narrower than they should be. So rather than a new bacterial infection, this is your asthma reacting strongly to that initial virus. Our focus should be on calming that inflammation down and managing those specific asthma symptoms.
Oh, I see. So what should I do instead? I just want to feel better.
Of course, let's focus on how we can manage these symptoms effectively. Mihiraa, the most crucial step is to use your inhalers exactly as prescribed, especially your preventer inhaler, as this will help calm the underlying inflammation in your airways. Staying well hydrated by drinking plenty of water will help to thin the mucus, making it easier to cough up. You might also find some simple remedies like a warm honey and lemon drink very soothing for your throat and can help reduce the coughing irritation. While we're on the topic of managing this, what other questions or concerns might you have about what we've discussed?
I suppose I'm just worried about when I should be worried. How will I know if I need to come back?
That's a very good question. It's important to monitor your symptoms closely. I would advise you to book a follow-up appointment with your GP if this cough persists for another week without any improvement, or if your symptoms worsen significantly. For instance, if your breathing becomes more difficult, your wheezing increases, or you develop a high fever. This would be to rule out any complications, allow for further investigation if needed, and to discuss alternative treatment options. Does that plan sound manageable for you?
Yes, it does. Thank you for explaining everything so clearly, Kevin.
You're very welcome, Mihiraa. My main advice is to be diligent with your inhalers, rest up, and don't hesitate to seek help if things change. You take care now.